Hello everybody, it's Juan Pablo Scarano, and today we will start explaining all the different types of testicular germ cell tumors that may show up on your exam. Before getting into details, I will start explaining the most important characteristics all these tumors have in common. First of all, remember that these tumors account for 95% of all testicular tumors. So the likelihood of having them on your exam is really high. Besides that, remember that the highest incidence rates are found in young men and patients with certain risk factors. By the way, do you know which risk factors I'm talking about? Yeah, that's right. Klinefelter syndrome and cryptorchidism. And last but not least, remember that none of these tumors will transilluminate, as opposed to what happened to testicular hydrocele. Remember that we are talking about a solid mass and not about liquids. As you may have noticed while going through the question bank, the USMLE Step 1 loves asking exceptions to general procedures. This is an example of this. As opposed to what happened with all the other tumors, in testicular cancer, it's never a good idea to biopsy the tumor because of the high risk of dissemination and metastasis to the lymph nodes. That's why it's generally preferred to perform a radical orchidectomy even if we don't exactly know which type of tumor we are talking about. Now that we have explained the most important characteristics of testicular cancer and that we have somehow become experts on the topic, let's get into details and let's go through all the different types of tumors that may show up on the day of the exam. I will start with seminomas. Why? Because they are the most common type of testicular germ cell tumor. If you are given a histology slide like the one on the left, remember that you should always look for the histological landmark of this tumor, which is those fried egg appearance cells. So if you get to see them, just go for seminomas. Another important thing to bear in mind is that patients will usually present with very high pulp levels. This is a kind of a giveaway because remember that placental alkaline phosphate levels will only be markedly elevated in seminomas and not in all the other testicular tumors. So feel lucky if on the day of the exam you get a question saying something like the patient had elevated pulp levels or pulp levels were not normal. If they say something like that, go for seminoma 100%. To end up with this tumor, remember that they are pretty radiosensitive. So they usually respond to treatment and they are somehow more benign than all the other testicular tumors. Alright, so let's move on to the next type of tumor, which is yolk sac tumors. It's important to know that they are very common in young children, especially in those who have less than 3 years. Something they love asking about this tumor are the scalar duval bodies, like the one we can see on the photo on the left. These structures, which resemble primitive glomeruli, are pathognomonic for yolk sac tumors. So if you ever get to see one of them, just go for yolk sac tumors because they are very, very, very characteristic. Another important thing to note is that patients will usually present with elevated AFP levels. Let's stop for a second. Can you tell me in which other tumor was AFP elevated? Yeah, that's right, in hepatocellular carcinoma. As opposed to what happened with seminomas, prognosis of these patients is going to be a little bit worse. They have a worse prognosis. Okay, we are almost done. Now we are heading to choriocarcinoma. Choriocarcinomas are a malignant type of tumor produced by a disordered growth of syncytiotrophoblastic and cytotrophoblastic elements of the placenta. Remember that patients will present with elevated beta HCG levels. So if you ever get a question of a male patient with elevated beta HCG levels, you should have choriocarcinoma within your differentials. It is very important to note that symptoms like hyperthyroidism or gynecomastia are very, very, very common. Do you know why? Yeah, that's right, you were right. Because the alpha subunit of HCG is almost identical to the alpha subunit of other hormones like TSH, LH, or FSH. So if beta HCG levels are higher than normal, they will be somehow stimulating other receptors that shouldn't be stimulated in virtue of their alpha subunit. Okay, now we will start talking about teratomas. And as opposed to what happened with women, in which they were always benign, in males, they change a little bit. They are still benign in children, but in mature males, they are malignant. So just bear in mind that teratomas will only be malignant in mature males, but they are always benign in children and in women, no matter if they are mature or if they are young. Okay, to finish the lesson, I will start talking about embryonal carcinomas. These are malignant tumors that present as hemorrhagic masses with necrosis. They are usually painful and they have a very bad prognosis if we compare them to other tumors like, for example, seminomas. We can divide these tumors in two groups. First of all, pure embryonal carcinomas that are very rare, and mixed embryonal carcinomas that may show up on the exam like a histology slide with a mixture of different tissues. If you get something like that, just go for mixed embryonal carcinoma. These two groups also present some differences regarding lab values. If we are talking about pure embryonal carcinoma, we will see that patients will present with elevated beta HCG levels, and that's all. But if they have a mixed embryonal carcinoma, apart from having elevated beta HCG levels, they will also present with elevated AFP levels. So this is something very important to bear in mind if you get a question about these tumors. Okay, and that's all for today. I hope you loved the lesson, and please do not hesitate to ask if you had any questions. Thank you very much.